Hello, everyone. I'm Vanessa Grossel, Policy Analyst at the Council of State Governments. I serve as a staff liaison to CSG's Healthy States National Task Force, which is composed of 4 subcommittees examining such topics as capacity, preparedness, and resiliency, leveraging innovation, state health systems, return on investment, and interventions to save lives. I'm joined today by Leanne Gassaway, Vice President of State Government Affairs for CVS Health, as part of a series on Voices from the Front Lines. CVS Health is a healthcare innovator, which includes CVS Pharmacy, CVS Caremark, and Aetna, as well as other subsidiaries changing the way healthcare is delivered to help people on their path to better health. In her role at CVS Health, Leanne is responsible for overseeing state affairs in all 50 states and with a variety of political and regulatory organizations. She frequently testifies at national and state venues regarding healthcare matters, including pharmacy issues, rural health matters, and administrative challenges. CVS has a robust enterprise covering many avenues in the healthcare space. It seems that every day I read that the company is launching another initiative to help address COVID-19 from the front lines. So we're really excited to have Leanne Gassaway with us today to talk about how the company has engaged in the response to the pandemic.
Well, thank you, Vanessa. And yes, we have been very busy. And as most people recognize us as our CVS pharmacies, that's just really a part of who we are. CVS Health is a full healthcare innovation company who employs more than 30,000 frontline clinical practitioners, including over 10,000 nurses. CVS Health is such a unique healthcare delivery model. Through our multiple touch points with consumers, we have a greater ability to engage them in the care that they need. It's very important to us to touch them when, where, and how they need it. And the time to do this has never been more important than now. Since the onset of this pandemic, we have been partnering with states to leverage our size and scale and integrated capabilities to help meet the needs of consumers, the business community, and it's been extremely important for us to try to reach populations that have been disproportionately impacted by the virus. We are uniquely positioned to address America's needs in local communities, in the individual's home, through technology solutions, to put healthcare services right within reach of those who need them. We have a presence in nearly 10,000 communities across the country and have a unique mix of assets that make healthcare accessible, simple, affordable, and we take our frontline, it's taken to the front line by our pharmacists, technicians, our retail team, our nurse practitioners, our physician assistants, and our nurses. And so we've really been looking at this holistically from the very beginning.
So tell me, from day one, how did the company activate to respond to COVID-19 once it was evident that it was spreading in the United States?
We asked ourselves, how can we use our scale and capabilities in the most impactful way? And we continue to ask ourselves that question every single day in response to COVID. And so we got right to work. We'd looked to increase access to treatment, healthcare services by waiving cost sharing and copays for COVID-19 related hospital admissions, testing, and treatment. We increased access to medicines by waiving charges for home delivery from our stores, allowing more 90-day prescriptions so people could manage their conditions easier. We waived early refill limits so people would not have to go into the store on an urgent basis. We increased access to virtual care by waiving telemedicine fees and encouraging patients to use telehealth to access the healthcare that they needed, instead of having to try to access that in an in-person medium, and saw a 600% increase in virtual visits alone through our Minute Clinics. We increased access to testing in a very big way. We started with one pilot store in Massachusetts and learned a lot from that experience, which led us to launch 5 large-scale rapid testing sites. And then in even better approach to try to reach each of the communities that we serve, we have now launched over 1,400 CVS pharmacy locations that are serving as testing sites in the communities right where they live. And we have now also expanded into 9 community testing sites to reach hard to reach and vulnerable populations. We are now turning our sites to helping America get back to school and to get back to work through our return ready testing programs aimed at employers and universities to help them plan for the fall. We are also increasing access to hospital beds as we see hospital capacity become a greater issue again, and have partnered with several hospitals to transition certain IV therapy patients back to home-based care and get them out of the hospital to free up those hospital beds and get them into a safer environment. And that's just kind of what we did for our customers and our clients. Equally important, we turned our immediate attention to our workforce, our teammates, the individuals that are on the front line every day as essential workers, and that includes our support staff as well, knowing that their role would evolve and that the challenges that they face would no doubt change and be stretched in the face of the pandemic. So we immediately went to address the needs of our colleagues across our organizations. We procured and provided protective personal equipment, protective barriers. We put social distancing in our stores. We implemented other safety measures for frontline staff and our office-based colleagues. We quickly moved approximately 45,000 people from office-based settings to work from home to ensure that our employees were protected. We provided employee bonuses to our frontline employees that were essential workers and worked on the front lines at our CVS facilities. We made paid sick leave available to part-time employees for the duration of the COVID-19 pandemic. In addition to the 14-day paid leave the company provided to any employee that had tested positive so that they could focus on getting well and their need to quarantine from potential exposure. We offered dependent care financial assistance to our colleagues to help as they transition to an alternative work arrangement, knowing that that would be critically important as they move to home-based environments and would need assistance with childcare. And then we also knew that there would be increased demands on the front lines, and we needed we were going to need additional help there. So we accelerated our hiring process and added more than 30,000 new teammates during the pandemic thus far, with our goal of hiring almost 50,000 associates across the enterprise to meet the needs of the communities that we serve.
And how did the anticipated spread of COVID-19 change the CVS pharmacy customer experience?
Yeah, we made changes to our in-store experience, not only to help our teammates, but to also to help our customers. We adjusted to accommodate for social distancing. We enhanced the safety of our teammates and customers with plexiglass barriers, provided special hours for vulnerable populations. We implemented safety protocols in our stores so employees would do a self-care check every day. We posted signs encouraging the use of face masks and face coverings for customers and social distancing markers on the floor to help customers and our associates be safer so we could continue to provide the essential services that we knew our customers needed. We made it easy for customers to continue to access the care and services they needed from the safety of their own home. We provided expanded access to care through virtual channels. As I said, relieved barriers for refilling prescriptions and offered free home delivery service. And just on that matter, we have seen 1,000% increase in the use of our home delivery during this crisis, which really shows that customers understood the importance of keeping their healthcare front and center, but also being able to access that from home and making that more convenient, and doing that in partnership with our customers.
You mentioned testing. At what time was community testing a part of the conversation?
You know, we did it right from the beginning, and with our government affairs teams partnering with federal and state and local leaders, we have been in constant conversation since the beginning of the pandemic. In April, CVS Health partnered with Federal Health and Human Services and joined forces with state government in Connecticut, Georgia, Massachusetts, Michigan, and Rhode Island to help increase access to rapid COVID testing with large-scale drive-through testing facilities. We put up big tents. We trained our pharmacists, our pharmacy technicians, our nurse practitioners in the proper and safe use of testing techniques, and equipped them with full protective equipment to serve the public. And we were able, through those large-scale testing facilities, to process up to 1,000 tests per day, all the way through June. It was in partnership with HHS, law enforcement, the National Guard, and several other local entities that helped bring those testing sites to life. And from April all the way through the end of June, when we phased those sites down, we completed approximately over 200,000 tests at those 5 sites, which was critical to helping those states get in front of the COVID crisis. But we didn't stop there. CVS Health has a mission of being local. So we went back to the drawing board to see how we could increase testing in the communities that we serve each day. And so in May, CVS Health began using our retail pharmacies for drive-through COVID testing to bring testing closer to home. As of today, we have about a little over 1,400 testing sites in 34 states and the District of Columbia. Patients make appointments online through our Minute Clinic website. They pick the location, the date, and the time. Our pharmacy staff guides the patients through the self-swab process at the drive-through window at our pharmacies. And we've partnered with commercial labs who process those tests and assist us in reporting results back to the patient. This has made our ability to make COVID testing more accessible, and it bolsters states' efforts in managing the spread of the virus. We purposely cited testing availability to reach a really broad spectrum of communities. And in fact, more than half of our sites serve communities with a need for support as measured by the CDC's Social Vulnerability Index, SVI Index, where we have identified communities that are underserved and need the testing in a big way. From recent reports that we've analyzed, CVS Health is estimated to be performing about 5% of the nation's testing today. And in some states, we are performing up to 15% of a state's total COVID testing. And as of last week, I am proud to share that CVS has performed over 1 million tests at our retail sites. And we really believe this is a significant milestone.
That's fantastic. Thank you for sharing. I understand that last week CVS Health announced the Return Ready program for employers that you mentioned. Can you tell us more?
Yes, we are excited in launching Return Ready, which is customizable. It's a testing solution specifically aimed at employers and universities. And the solution helps return these employees to the work site and get students and faculty and staff back to campus. It integrates that COVID testing on an ongoing business need. It is flexible, it is clinically based, and it's trying to use clinical protocols as well as additional health and safety solutions that are brought right into the workplace or right onto the campus as part of their return strategy. And it helps these businesses plan for ongoing business continuity. In the program, we provide a team of dedicated full-time professionals who help design, stand up, manage, and evolve that testing and vaccination service on campus or at the employer's work site or even through our retail locations. The employer determines who to test, where to test, either in the community or at a business site, how to test, either through what we call swab and send, which is when somebody swabs their nasal cavity and we send that specimen off to a commercial lab for processing, or through our rapid response technology right on site. We are also partnering with states to develop nursing home testing solutions to help address the unique needs needed in long-term care facilities, and partnering in that space to help with infection control. We just recently announced we are partnering with the Commonwealth of Pennsylvania and the states of Texas and North Carolina in offering COVID testing in their skilled nursing facilities and assisted living facilities statewide. These types of collaborative partnerships allow us to take trained personnel and expertise right into the facilities and help assess infection status, so each employer, each campus, each long-term care facility can take appropriate action to protect their patients and their staff.
And what about your frontline nurse teams? Where have they been engaged during these interesting times?
Yeah, as I mentioned, we have a significant nurse workforce within the CVS Health enterprise. You may be familiar with our Minute Clinic, frontline nurse practitioners, but we also have accordant nurses and clinical teams that provide 24-hour support to Caremark patients. We've also had the unique opportunity to help address hospital capacity, as I mentioned. Through our Quorum program, we have seen that we are able to help communities stretch their local hospitals that are at high capacity. We're working with hospitals and providers, including UCLA Health in California and Piedmont Healthcare in Georgia, to support solutions for creating much needed hospital bed capacity during the pandemic. Quorum is one of our unique CVS companies and has an enhanced existing home infusion service that we have used now to use their capacity and their capabilities to help transform and transition eligible IV therapy patients from the hospital to home-based care, where those nurses can go into the home and help care for those patients in a safe environment. We've successfully expedited hospital discharges by assisting these low, medium, and high acuity IV therapy patients and getting them out of the hospital and into home treatment. And so far, we have transitioned over 600 patients through this program.
So retail pharmacy, retail testing, business-to-business testing, long-term care testing, new delivery models for nurse care and home infusion. What other changes do you foresee in the front lines going forward?
You know, as we think about changing the changes that COVID-19 has brought to care, we have really seen two critical issues that have been highlighted through the crisis that are important to mention. One is the need for behavioral health services, and the other being access to telehealth services. So we may not consider these frontline services, as much of this may be done in a virtual setting, but it still is, using our healthcare system to the greatest extent. The importance of both of these healthcare issues has existed within the healthcare system prior to COVID-19, but they've really been pushed to the forefront as providers and insurers have partnered to ensure access to care. In relation to behavioral health, this crisis has raised the awareness of our need to address and improve access to mental health and well-being services. We are focused on addressing the mental health needs of our customers and the needs of our communities that we serve. It is incredibly important to ensure that people have access to mental health services during a crisis like this. Since March 1st, we have seen a 200% increase in virtual mental health visits as compared to the same period last year. And this includes substantial increases in calls for help with psychological distresses such as anxiety, grief, loss, and trauma. Healthcare workers are under extreme stress and anxiety, fighting to save lives, while in many cases isolating themselves outside of work to keep their own family safe. Self-isolation affects older adults whose only social contacts are often outside of their homes. Those who don't have close family or friends living within their personal safe zones and others who rely on outside contact through social programs and community activities can find themselves at an increased risk of mental health distresses. So to help address America's expanding mental and emotional well-being needs, CVS Health enhanced its nationwide mental health programming with charitable investments focused directly on healthcare workers, essential workers, and seniors. And this has proved to be extremely important. The second important change that we expect to see is access and use of telehealth, given the important role that remote provider access has played in delivering healthcare to millions of Americans during this critical time. Telemedicine providers have helped with non-emergency health issues like respiratory infections, flu symptoms, other illnesses, as I said, mental health. They can evaluate symptoms and provide medical advice and treatment. Which can include prescriptions if medically appropriate. Some have also provided behavioral health and specialized support for dermatology or even physical therapy. So it's really broadened the opportunities of clinical providers in both our standard network and in our specialized telehealth vendors to meet the needs of patients right there in their homes or right where they need them. Telemedicine physicians are answering questions about the virus. They can assess a member's risk. They can provide symptom relief. And it was very encouraging that the CARES Act, the Coronavirus Aid, Relief, and Economic Securities Act, signed into law in March in the federal arena, recognized the importance of telemedicine and clarified that health plans could cover telehealth on a pre-deductible basis, meaning before their deductible had been met, in order to open up the opportunities for people to access health care in an easier way and continue to be eligible as a eligible expense for a high deductible health plan. That is critical to just really opening up a given service that had not previously been available to patients who may have needed those services. And we have seen all ages of people in all different types of circumstances using telehealth safely and effectively to get the care that they need from their providers. Even our infusion nurses have been using telehealth to help remotely monitor patients who have critical needs and need to be cared for at home. So it's really opened up an entire world of care that is patient-centric. And at CVS Health, one of our goals is to simplify healthcare. And telehealth has proven to be part of that simplified solution.
Do you have any last thoughts you'd like to share?
Just thank you, Vanessa, and a special thanks to CSG for letting CVS Health share our perspectives from the front lines. We also just want to thank our members and our partners in industry, government leaders who have been collaborating with us in order to meet the needs of their constituents and our customers during this pandemic. During these unprecedented times, successful collaboration and coordination between the private sector and our government partners has never been more crucial. And I'd really like to thank our state and local leaders for that. It's been an amazing partnership.
Well, thank you for joining us today, Leanne. We appreciate you for sharing your expertise with us during this unprecedented time as well. I'm Vanessa Grossel at CSG headquarters in Lexington, Kentucky, and I've been speaking with Leanne Gassaway, Vice President of State Government Affairs for CVS Health.